All right, preventative coverage. This is another one where the regulation, when I talk about our implementation plan for all of this, we made a bunch of those decisions before this preventative services regulation came out. It came out just a couple of weeks ago. It's pretty clear on some things. It did not go to the degree of saying, here are the codes, right? When we put stuff in the system, we have to say, this code is a preventative benefit that this applies to, and therefore no cost sharing, and therefore has to be covered. It didn't go quite that far, so we're digging through that. I think the big takeaway I would have here is we're still working on this one because the regulation came out so recently. But like Justine said, there's a lot of good things that say, you know, you can't go in for a big office visit and have a copay and say, by the way, do something preventative so I can get out of paying the cost sharing. You know, so there are some reasonable protections in there. And when we look at our standard preventative services benefit, we tend to cover in a very comprehensive way most of the services. So I think there's not going to be a big expansion in the number of things that are covered, but for those plans that have cost sharing associated with it, this will cost some money. But we're not at the point of ready to say, here's how we're going to implement this one because we just got the regulation. There's a point too that this is one of the areas where if you're a grandfathered plan, you don't have to implement this, and we'll talk about grandfathering a little bit later. Okay, rescissions. This is the rescission story, right? The example of rescission that came back during the debate was, you know, someone bought an insurance policy in the individual market. They were diagnosed with cancer, and then the insurer said, hey, you didn't tell us on your application that you had acne, or we're taking acne medication, and therefore we're going to terminate your coverage, give you back your premium as if we never had insurance policy. Now, this is what this was trying to get to. It seems like a good idea. We agree. We've never really had a practice of doing this anyway. I didn't write it down because I can't believe that it will last. But I want to bring up an issue, not to freak everyone out a little bit, but the example they gave in the regulation around this included retroactive adjustments to membership from employers. And I can't believe that that was the intent of the policymaker, and we're working really hard with the association to advocate on all of your behalf. And the example was, oh, I forgot so-and-so terminated, you know, they don't work here anymore. And that happened 2 weeks ago, and I'm just getting it to you now. The regulation actually says, and it's an interim final rule, so the bargaining action, that's going to be the lawsuit. It says that person has to have coverage up until the point that it actually gets to the insurer and is taken off the system. You can't say, oh no, that person didn't stop working here 2 weeks ago. That would be considered a rescission under the current form of the law. That's a big deal. I know we already have issues about the time frame that we're working through rescissions on. This would make that problem a lot bigger, but it is in the law. We're hopeful that the administration, when they realize how things actually work in practice and the things that you have to do every day to make, and we work with on every day. But I just wanted to put that one out there that says, in the next, by the end of September, the comment period, if this is open, there's a chance that it could come in, and that would cause all of us to do a bunch of work to try and figure out how to not have retroactive adjustments to membership at all. It would become illegal at that point. It seems not to disappear. The intent of the law, when we talk to our public policy people and legislative intent and all that sort of thing, but it is in there at the moment. So, I'm feeling good about that one.